Welcome back. So we haven't had a major snowfall yet, but we know shoveling sidewalks and the driveway is right around the corner, and you could end up in the ER if you don't do it right. Dr. Rachel Hailey of HCA Midwest Health stopped by with smart strategies for staying healthy this season. We've all heard of this heart attack snow. Does this mean that from shoveling snow, it could potentially put us in the ER?
You know, it sounds simple, but, shoveling snow can actually put us at higher risk for a heart attack, according to the American Heart Association. If you remember that brutal winter storm the East Coast had a couple of years ago, Winter Storm Stella, 10 deaths were attributed to shoveling snow. And each year, 100 Americans die from cardiac arrest associated with snow shoveling.
Okay, and you've got a snow shovel here. What is it that you like about this one?
Well, it's important to know what happens. Why are people having heart attacks? And it's a combination of the cold temperatures and the physical labor all at once that increases the work on the heart. So one of the things we recommend is using a smaller snow shovel so that you're shoveling less wet snow at one time, which will decrease the work. So yes, and other things that we recommend are, taking frequent breaks, drinking warm liquids, avoiding alcohol or heavy meals before or after you snow shovel. And people over 60 may want to consult their physician and ask them about whether they're okay to, do any type of winter activity, especially snow shoveling.
I love that idea because, for instance, even if you do work out, you may not be working the same muscle groups.
Right, exactly. And, a lot of people are just fine to snow shovel, but there are people that are at risk. They don't know they have high blood pressure or high cholesterol or diabetes. So, everyone should be cautious.
Okay, and let's talk about one other thing. A lot of people know we are in flu season. So what's the latest on the flu this year?
Yes, we are underway in North America on the flu season. We are seeing cases in our ERs and our doctors' offices. We often will look to Australia's flu season as a predictor of what our flu season might be like. And they started early, and their health department says it was one of their worst seasons. 93% of cases were associated with influenza A. But even more scary is, the CDC says our last flu season was moderate severity. It resulted in,
So last year's was actually more moderate.
Yeah, it was moderate for us, but what we found was it was a long season, 21 weeks, which makes it the longest flu season in 10 years.
Yikes.
Resulted in 40 million flu-related illnesses. Yes, over 500,000 hospitalizations and 36,000 deaths. So the CDC recommends that everyone, or most everyone, over the age of 6 months, including pregnant women, get their flu vaccine. It can decrease your chances of getting the flu, and even if you do get the flu, it can decrease the severity of symptoms.
Okay, so 40 million cases last year. Is there anything else besides the shot that we can do to prevent getting the flu?
Yeah, absolutely. Some of the biggest tips we say: frequent hand washing. Get in a big routine of washing your hands, covering your cough with your arm or your elbow, and wiping down, surfaces such as doorknobs, sinks, countertops, handrails. Even our phones are gross. When you fly, I take a little thing of the wipes and I wipe down the armrest. So, the flu virus can last for 48 hours on surfaces, and cold viruses can last 24 hours.
Well, all great tips there from Dr. Hailey. For more information, head to hcamidwest.com. There you can also find a doctor as well as the closest ER and urgent care near you.